What is hypertension?
Hypertension is a syndrome where the heart really has to work against pressure that's developed in the vessels, and it becomes harder and harder for the heart to work because the vessels themselves are increasing their internal pressure.
What are the risk factors?
When the vessels are under pressure, it can impede blood flow and stop good flow to all the organs. So as a consequence, you could have kidney disease, heart disease, or even strokes or heart attacks. The increased pressure damages the vessels and also damages the organs. But more importantly, especially from the standpoint of a cardiologist, is it's increased pressure that the heart has to pump against. So every time the heart beats, it puts too much pressure on the heart because the pressure that it's pumping against is just simply too high.
Why is it called the silent killer?
High blood pressure really doesn't have any symptoms until it's too late. One of the problems with high blood pressure is it's a silent disease. Again, people think of it primarily as something, oh, if you have high blood pressure, you're going to have a stroke. But the stroke is only the final culmination of that large vessel damage. It's that small vessel damage being done to every single organ of the body all the way through the time of untreated hypertension that creates organ failure for so many people.
How can you treat hypertension?
Most hypertension requires a combination of diet, lifestyle, and medication. There's probably over 100 blood pressure medications out there on the market. Some people are well controlled on single medications. Some people need multiple. Some people need low doses of several medicines to get adequate blood pressure effect without having any side effects. So there's many, many options for treating blood pressure. Now that said, you can also help by keeping yourself in good condition. Exercise or just activity keeps blood pressure down in most people. Not being overweight keeps blood pressure down in most people. Treating diabetes or treating high cholesterol helps to keep blood pressure down because it decreases the strain on the body overall.
My blood pressure is 120/80. What does that mean?
The upper number represents the pressure that's generated in your vessels when your heart contracts, and the lower number represents the pressure in the vessels when the heart relaxes. So the blood pressure can go up and down as the heart pumps. What we listen for is that upper number. It tells us how much the heart is pumping against. And we listen for the lower number because that tells us how tight the vessels currently are. 120/80 used to be considered right in the mid-range of normal. Now we really consider that the upper limit of normal. For most people, we'd like to see their blood pressure 120/80 or lower.
I've read that over a lifetime, the risk of developing hypertension is 90%. Is this true?
High blood pressure may be a natural progression of hardening of the arteries in many people. When we decide we're going to treat high blood pressure, we're trying to treat it because of the long-term consequences. And although older patients with high blood pressure are at increased risk for stroke and heart disease, younger patients, and when I say younger, I mean people in their late 40s and early 50s who do not yet have the consequences of long-term hypertension, need to be especially vigilant about making sure their blood pressure is in control, taking the medications, and seeing their physicians regularly.
For more information about detection and treatment of hypertension, see your doctor or visit webmd.com.